Greetings, Zimbabwe, Africa, and the world. Welcome to In Conversation with Trevor, brought to you by Titan Law. I go beyond the headlines and beyond the sensational. Today, I'm in conversation with Dr. Charles Muronda, who is the Chief Executive Officer of Lancet Clinical Laboratories. Dr. Charles Muronda, welcome to In Conversation with Trevor. Thank you so much for creating time within your busy schedule. As one can imagine, during this time, you must be running around quite a lot. So thank you so much for your time.
Thank you, Trevor, for inviting me.
Charles, you were educated at the University of Zimbabwe, and then you went abroad to enhance your education. Please talk to us about your education, you going to the UK and coming back to practice.
Okay, I studied medicine at the University of Rhodesia and qualified in the late 70s. Shows how old I am.
Right.
Yeah, and then I went off to the UK to specialize in pathology. And I got my qualification, or rather I was admitted to the fellowship of the Royal College of Pathologists in 1986.
And then you came. Sorry, and then you came and you worked briefly in government. Talk to me about that, and then moving on to the private sector.
Okay, yes, I was the Director of Pathology Services and Laboratory Services in the Ministry of Health from 1990 to 2000, which is a span of 10 years. And then I joined the University of Zimbabwe as a senior lecturer in the medical school. I was there for a good 8 years before I decided to go into private practice.
And you're now in private practice, Charles, and you are the Chief Executive of Lancet Laboratory, Clinical Laboratories, rather. Speak to me about the day-to-day work that Lancet Clinical Laboratory does.
Okay, well, we are a pathology service provider. That's our core business. As you know, pathology is basically the study of disease, basically gives answers as to what disease process is happening in the person. We have the answers that we give to the doctors that obviously they then convey to you. We are the backbone of medical services. So Lancet Clinical Labs is basically a pathology service provider, and our branch network spans across the whole country.
Okay, so we're talking to you primarily because of the COVID, coronavirus 19 that we are all facing. And I know you are involved, you're running around. What have been the first impressions that you've gotten from what the country is facing at this present moment?
Well, we've seen this thing unfolding over the last 3-4 months when it started as an epidemic in China, in Wuhan, and its evolution into a pandemic, and the World Health Organization declaring it a pandemic on the 11th of March. And we've seen it move across the globe. We have it in South Africa, we have it in Zimbabwe. So, I mean, it's something that is upon us. In terms of preparedness, I think, we in the private sector have not been involved with what's happening in the Ministry of Health. So I really cannot comment too much about that. Yeah.
So, but I know you believe that there are 3 key things that need to be done, which is prevention, diagnosis, and treatment. Shall we focus in the first instance on prevention? What are the prevention measures that we ought to be focusing on as a nation?
Okay, right. I think it's important to stress that this condition is not curable if you get the complications that we're seeing people develop. Therefore, prevention is very, very important. Is the basically cornerstone for us to flatten the curve, to reduce the number of people that get infected. This is a condition which is spread by droplet infection. Those that have it, sneezing and coughing, and obviously if you breathe the droplets, that's how you contract the disease. So we have to break that cycle. And the mechanisms of breaking that cycle, the cornerstone is social distancing. That's why you've seen most of the countries have, are basically in lockdown to make sure that there's minimal, human-to-human contact. Social distancing is the key. People should really stay at home, and hopefully with time, this virus will disappear and things go back to normal. There are many things that I'm sure we're all seeing on the internet, on social media, which are very important. WHO website is a lot of information. The washing of hands with soap, sanitizers, very, very important. Avoiding touching your noses and your mouth, that's very important, because that's how you can actually spread infect yourself. So those hygienic measures are very important.
Right. Talk to me about there's a lot of debate going on about the masks. How useful are the masks? Who should wear the mask? The infected person, or a person who's not infected, who's trying to avoid being infected? Who should actually be wearing the masks?
Yeah, I think that's a very important question, Trevor. I think what's happening is that regarding masks, I think, as the disease evolves, people's advice, or rather the advice from WHO and authorities, is changing.
Yeah.
There are some authorities that actually say that, people should be wearing masks all the time when they're out there or interacting with other people. Now, the challenge with that is that the number of masks that are available is not enough to meet that sort of a standard where everybody is wearing a mask.
Right.
The guidelines that the WHO has put out at the moment is that if you are healthy and you're not sneezing or coughing, there's no need for you to be wearing a mask, okay? But if you're a caregiver, you're on the front line looking after patients with COVID or people that have upper respiratory tract illnesses, then obviously you should protect yourself by wearing a mask. That is very, very important. If you yourself are unwell, you're sneezing, you're coughing, you obviously should wear a mask so that you do not infect other people. Now, in saying that, it is important to know how to wear a mask.
Right.
And I would urge people to go onto the WHO website. There are video clips which show people how to wear a mask. Because quite often people put on a mask and then they touch the front of the mask and infect themselves. Wearing a mask does not remove the other things that you need to do, like washing your hands and social distancing. It's just part of the many things that we have to do to minimize your chances of getting infected.
Charles, what do you say if I'm leaving home now to go and buy groceries? Should I put on a mask? I'm well. Should I put on a mask to protect myself from getting the disease? What advice would you give there?
You know what? I would say that if you do have access to a mask and you're going out there to a supermarket, in addition to self-distancing, which means that you make sure that you stand at least 1 meter away from everybody around you, if you have access to a mask, you should wear it. I think it's good advice.
So the next thing is the availability of these masks. First of all, the mask for me to put on, the protective clothing for the caregivers, doctors and nurses and so forth. What's the availability of those in Zimbabwe at the present moment?
Well, you know what? That's a good question as well. I know that the Chinese government or this rich billionaire has given donated stuff to
Jack Ma. Yes, Jack Ma, yeah.
Exactly, yeah. I don't know what's in there. We don't know what's in there. So really, I cannot comment. But as you know, Zimbabwe does not produce any of these materials. Right. We import them from South Africa, UK, America, and Germany, and so forth. So availability at the moment is almost zero because most of the outlets that would normally sell these things, they've run out. They've been bought by people, obviously, for obvious reasons. And then obviously institutions that need these materials, like hospitals, clinics, and so forth, they've run out, you see. So it's a big, big problem, because the PPE, the personal protection equipment, is critical. A caregiver cannot attend somebody with COVID without protecting themselves. And we've seen on the news that the death rate among healthcare givers is very high. A lot of doctors have died in Italy who have actually attended to patients with COVID. So it's understandable when a caregiver, a doctor says, I cannot risk my life to go and look after patients with COVID when there's no PPE. It's very, very important. So I really don't know how much of that is available in the Ministry of Health. In the private sector at the moment, there's really not much.
I've seen, though, Charles, some universities, I think Bindura University, they're manufacturing stuff there. Are you aware of any of that stuff getting to you guys?
Well, I've heard that a number of individuals in Zimbabwe have started making their own PPEs. Yeah. Obviously, the quality of the PPE is very, very critical. Right. The PPE prevents the virus from getting onto the person who's using it. So the quality is very important. I would imagine that the ministry, through its various departments, would have to actually sanction whatever PPEs are produced before they are allowed out onto the markets. Because you don't want to give this false impression that people are protected by wearing PPEs that are actually not up to standard.
That's an important point, Charles, which invites the comment perhaps that the Standards Association of Zimbabwe at some point will get involved. Let's move on now, Charles, to the diagnosis. How do I know I've got this thing in me? Just explain that to us.
Okay, right. This virus settles in the upper part of the respiratory tract, the nasopharynx and the throat. So in able to actually identify or confirm that the virus is there, we use what is called a nasopharyngeal or a throat swab that is put at the back of the throat and is moved around to take the mucus and stuff there. That's our sample. And then it's obviously taken to the lab in what we call viral transport media. That's very important as well. You can't just put it in any solution or substance. There's a specific liquid that is used for transporting this stuff. Now, the test itself is called PCR. It's been around for over 20 years. We actually do it here. PCR is a test that actually determines the presence of viruses in samples from human beings, in animals. PCR has been around for a long time. That's what we use for HIV, viral loads, and all these viruses that affect human beings. Now, with COVID, it's the same test. But the challenge that we have now is the kits, the materials, the equipment for testing for COVID is not readily available. What has happened is that the countries that manufacture these kits have got a high incidence or prevalence of this condition. And therefore, they are reserving or giving first preference to their own citizens. So you can imagine the US produces these materials, UK, Germany, South Korea, China, but they give first preference to their own citizens. So as a result, countries like Zimbabwe, most African countries, including South Africa, do not have enough of these kits to be able to test for the presence of COVID.
Okay. But as for me, so you am I right that a fever, a runny nose, a sore chest, are those some of the key symptoms?
No. Well, the main indicators for COVID are fever, which is your temperature above 37, cough, dry cough, okay, and shortness of breath. Those are the main indicators, yeah. But of course, there are other symptoms like, headache, achy muscles, sore throat, nasal congestion. Those are minor symptoms. Those three are the main ones, particularly fever. If you find that your temperature is high, then obviously that's a worrisome thing. And if you have a cough, in addition to that, and shortness of breath, that is really obviously worrisome. And obviously you need to seek help from your doctor.
Okay, so you say there is no cure for this. There is no antivirus at the present moment. What would be the treatment for somebody who's dealing with a relative at home facing this? You've said I should stay home, lockdown. What should the families be doing?
Yeah. Prevention is the cornerstone of stopping this condition from spreading. That is very, very important. But unfortunately, obviously, people get infected. Now, the good thing is that the majority of people who get infected actually do not complicate. They actually survive, and some, in fact, up to 20% may not even know that they're infected. Some people have a minor flu-like illness, which resolves in time. But there is a group of about 20% of people who may get, severe signs and symptoms. And among those, there are some who then need to be admitted into the ICU. And these people now suffer a condition called the ARDS, acute respiratory distress syndrome, where in fact there is damage to the lung, such that oxygen getting into the bloodstream becomes a challenge for them, and they need to be put on a ventilator. And this condition is, under normal circumstances, it's got a high mortality rate, up to 50-60%. So really, it's a situation which one would want to prevent by making sure that we focus on the prevention of the condition rather than, yeah. And of course, people that have got underlying elderly people, over 60, over 65, with underlying medical conditions, what we call comorbidities like diabetes, high blood pressure, who have got who are on warfarin for clotting issues, those people are more vulnerable to complicate. But of course, young people have been known to die from this condition. People who have been physically fit with no ailments have also been known to die. So prevention is really the key.
Okay. Let's move now to the issue whereby one would have thought that where we are right now, it's everybody's responsibility to get this thing under control. That there would be private sector involvement, government involvement in the testing particularly. Is Lancet Clinical Laboratories and other players like CIMAS and Bain's Pathology, are you guys involved in the testing at all? Have you reached out to government to see whether you can play a role, and has there been any response at all?
Okay, Trevor, let me just start by saying that, we see ourselves as not being government competitors to the government. We actually complement the services that the government provides to people out there. As you know, over the years, our services, the government services, are not where they should be. And I can speak for Lancet. We provide service to government patients on a daily basis. Our labs are open 24 hours a day, every day, and people rely on us for that service. The situation now, the COVID situation, is a national crisis. It's nothing to do with government or private. I think everybody who is in the medical services provision business has to come to the table. To think that the government or Ministry of Health can tackle this problem on their own without the help of the private sector is not really something that I think is wise. The participation of everybody with resources to do that must be facilitated. I think so. I think people should be allowed to help where they can.
Confirm to me, Charles, that Lancet Laboratory has a national footprint of between 15 and 18 centers all across the country. Is that the position?
Yeah, we are present in all the cities actually in Zimbabwe and most of the towns now. Our labs, as you say, we've got 15 labs across Zimbabwe. And we're well able to actually assist the government, to complement the government in providing this service. We're a fully licensed operator, and we're able to provide, and as I said, PCR is not a complicated test. It's been around for a long time. A lot of the labs in Zimbabwe, not only Lancet, are actually doing PCR for the viral loads. Obviously, as far as COVID is concerned, you now have to have certain minimum standards for safety reasons. What is called biosafety level 2. For you to be able to do the testing and give reliable results. We are well able to do that. And we're licensed to do that. But the challenge at the moment, as I said, is obtaining the kits that are required for us to run the tests.
Have you reached out to the government to say, hey, we are corporate citizens who are responsible and want to participate in this at all? Have you reached out to them, and what have they said?
Okay, I've been in communication with the highest office in the Ministry of Health, both in meetings, and I've written to the Minister for Health offering Lancet's services to complement the government services. I'm yet to receive to get a response. I'm thinking they're very busy there, obviously.
Well, they're busy, Charles, but one would have thought that this is something urgent. You're offering us facilities, a national footprint. One would have thought that the minister would have reached out to you and say, oh, please, by all means, let me come and join this fight.
Well, as I said, we've reached out. We have, I've spoken to the minister. I've actually indicated that Lancet is ready and willing to assist, in whichever way we can. So I'm waiting for a response. As I said, maybe they're very busy. It's a busy period for a lot of people. I think, maybe they're very busy there. I'm not sure what the situation is.
Well, Charles, I pray that by the time this interview is done, when you get back to your office, you'll find a response from the minister saying, come on, let's come in and do this battle together.
I hope so. I hope so, Trevor. I mean, as you say, this is a national crisis. I think the thing with COVID, I'm sure you've seen on the news, high-profile people that have succumbed to this disease. It doesn't matter whether you are, wealthy or poor or whatever. This is a national crisis, and I really think that everyone who is in the medical services sector who is able to help should be given the opportunity to assist the government in fighting this disease.
And Charles, there's been talk of chloroquine phosphate as a drug that might be able to help us deal with COVID-19. And I'm aware that the WHO is dealing with what they call candidate drugs, 40 of them, with 3 of them that are promising. What's your sense in terms of when are we likely to get a vaccine? And is chloroquine phosphate the solution for now?
Well, I think there's a lot out there about hydroxychloroquine phosphate. It has actually helped some patients who have actually developed complications of COVID. It's also been touted to prevent the development of complications. But this is all in the trial phase, okay? I don't think it has actually been proven that it actually can cure COVID. So for me, I think, well, it's chloroquine phosphate and antiretrovirals that have been touted as being able to cure COVID. But for me, the thing is that access to these materials for a third world country like Zimbabwe is not going to be easy, because the countries that make these materials are actually in short supply anyway. So for me, the most important thing is that let's focus on the things that work for us. Let's not say, well, because you know what, there's going to be a cure, we relax our guard. Prevention, prevention, prevention. We need to make sure that this lockdown is actually observed. People stay at home. Interestingly, in the last 2 days, I've been coming to work because, of course, we're in essential service.
Yeah.
I've noticed that the number of cars on the road has increased quite a bit. Today there are more cars than there were yesterday, which means that people I think are relaxing, and that's not good. We need to stay at home, for the prescribed 2 days and see what happens, and then obviously the situation will be reviewed. So for me, prevention is the key here. Let's not really be distracted by the cures and all that. That's going to come later on. But for the time being, the problem that Zimbabwe, South Africa, and all these African countries need to address is to make sure that we flatten the curve, minimize the number of people that contract the infection, and that way I think we'll likely be able to solve the problem.
Somebody in Mbare, Charles, and in Makokova is going to say to you that's social distancing is a luxury for the privileged, because I don't have water to be washing my hands, and physical distancing is actually a foreign thing, because I live very close to my neighbor and that kind of stuff. What's your response to that?
Well, you know what, Trevor, I think that's a very important comment. As you know, my origins are Mbare. I was born and raised in Mbare. It was called Harare then. But obviously, when I lived there, we were not as crowded as people are now. You've got 15 people in a small house. It's impossible to implement social distancing in that scenario. We've got people that have to travel maybe 2 miles to go and fetch water. It's very difficult to implement all these measures. People lining up to get water and so forth. Now, for me, it just takes one person to go into that environment and then obviously get an explosion of the condition. We then obviously have to make sure that during this, we identify, I think countries like India, which have similar issues, whenever somebody who's got this condition has been identified, that whole area is actually closed off. People cannot go in, you cannot go out. And they then obviously make sure that, the condition is contained. I don't know how we can enforce that. It's very difficult. I do understand it's very difficult to implement social distancing when people have to live, have to eat, have to drink water, and have to do the normal things that are essential for life. It's difficult.
Charles, this pandemic finds the health sector in a very unfortunate state, where doctors are unhappy, our infrastructure is not up to standard, nurses are unhappy, they're threatening to down tools. What message do you have for the doctors and the nurses, these people that we value so much, particularly during this difficult time?
Yes, you know what? It's the COVID thing is actually terrible. It's terrible for the whole world. But in some ways, it has brought to light the situation that is, obtaining in most of these institutions in Zimbabwe. As you know, Zimbabwe has got a very good infrastructure. The system was designed such that all Zimbabweans, whether they're in a rural setting, district, provincial, have got access to health services. We've got facilities that have been there since, independence. But unfortunately, over the years, these facilities have deteriorated tremendously. The state of our institutions is not good at all. We all know that. So that's a big challenge, that's a big challenge. And then, of course, the people that work in there, particularly the junior doctors and the nurses, these are the frontline people. These are our foot soldiers. These are the people that when you present to the hospital in the middle of the night, you're not going to be seen by a specialist or a consultant. You say a junior doctor and a nurse, they attend to you. So obviously the welfare of people like that is very, very important. There are certain minimum standards that are acceptable. The salary has to be commensurate. Where they live, the transportation, all those are basic needs that I think the powers that be have to address. I was a junior doctor myself. I went through the system. The situation that we had when I was a junior doctor and the situation that these young doctors are going through now is so different. It's actually very, very sad. All I can say is that the senior doctors sympathize with the junior doctors. And I'm sure you've seen them come out in the open to say that, the conditions that these junior doctors are having to put up with are not really acceptable. So, we really sympathize with them, but obviously the powers that be are the ones that need to attend to these issues and urgently as well.
Charles, what do you say to somebody watching you now and they're at home and whether it's psychologically or what, they're feeling unwell, they're feeling they've got a fever, what do you say to them? What should they do?
Okay, I think there's a lot of information as to how COVID presents. Okay, obviously if you've got a fever, you're coughing and you've got shortness of breath, you really need to seek medical attention. That is very, very important, But, if you've got other ailments that people normally have, the normal things that you should maybe consult your doctor, but really there's no need to panic unless you've got fever, you're coughing, you've got signs of an upper respiratory tract infection. Then I think maybe you then need to seek medical attention.
Tell me, I suspect, Charles, that your phone is ringing off the hook with friends and family saying, I'm not well. Is that the case, Charles?
No, the question that is coming up a lot is, when are you going to start testing? That is something that is, I'm asked every day. I can tell you this, Trevor. We've been doing PCR at Lancet, for a long time. We've now set up a COVID lab at St. Anne's Hospital. The equipment is there. The biosafety cabinets are there. What is only missing now are the kits to actually test for the virus. We have a consignment that we hope will be arriving in the country in the next 2 weeks. I know that is too long for a lot of people, but really, as I said earlier on, the challenge that we're having at the moment, and this is across the globe really, is the shortage of these kits because of the demand. This thing has evolved over a very short period of time, and the companies that make the kits are not coping basically, with the demand that is placed upon them.
So Charles, if the government came to you today and said you're free to start testing, here are the materials, are you saying to us you'll be able to roll out the testing throughout the country?
Well, what I can say is we can assist the government in rolling out the testing. We can sit around the table and say, the thing is, the infrastructure, the lab infrastructure in Zimbabwe is great. There are so many labs, both private and public, in the provinces, in the districts. Siemens has got labs. Premier has got labs. Lancet has got labs. I'm not saying that every lab should be testing for COVID. We can identify the labs that are suitable for testing in the various towns and provinces, be it a government lab or a private lab. We can come up with a solution that works for everybody.
But
so what we're saying is that...
So go ahead, Charles, go ahead.
I'm saying that what we're saying is that let's be in it together. Let's try and help each other. Let's not say this is a government problem. It's not. It's for everybody who can actually help. So if the minister's got the resources in the terms of the kits, the PPE, and whatever is required, I think some of that should be given to the private sector. And the private sector should be allowed to provide a service.
And this service is not for free. It's going to be provided at cost. So whoever wants to be tested would need to pay. Am I right there, Charles?
Well, obviously, we have to buy the materials. We have to recover our costs.
Yeah.
What I would say is that I think most of the labs that I've talked to through the Association of Pathologists, we're not in it to profiteer, to make money. This is not the time where people, really look and say, oh, what is the profit? We want to make sure this condition is contained. That is, to me, is the most important thing that we need to do.
Right.
So the cost really is not going to be very high, I don't think.
Confirm to me that as I'm talking to you right now, there's only one center that is doing national testing. Am I right?
That's correct. The only lab that's testing for COVID, that's doing PCR, is the National Reference Lab at Harare Hospital. That is the only lab at the moment that has got the test kits and is doing the testing for whoever needs to be tested. That's the only lab at the moment.
Okay. So just to say to our viewers at home, the time that we recorded this show, they were, I think, 9 people that had been tested positive, with 1 death and 8 that undergoing some care. Charles, we appreciate the work that you do. We understand the pressure that you're facing. We pray that by the time maybe the show gets out, the government will have reached out to you and said, come, let's join hands and let's fight this fight together. Charles, thank you so much. I know you are busy. I'm going to let you go, but before you stand, allow me to address our viewers at home and say thank you for watching this quality conversation. Remember, In Conversation with Trevor is a weekly show. And during this COVID-19 lockdown, we'll try and provide you with as much information as possible. So we might come to you much more frequently than we've done in the past. Thank you for watching. Thank you for supporting the show. So that you don't miss out on any of this quality conversation, I suggest you subscribe. Press this little red button here and subscribe. You get a notification every time we have one of these quality conversations. So until next time, cheers. Thank you.